silicone versus saline implants. So the difference between the two is a silicone implant has a silicone soft shell, and the inside is filled with cohesive gel made of silicone. So some people will call it cohesive implant, some will call it the classic gummy bear implant. A saline implant, on the other hand, is a shell that comes empty like this, and the surgeon will fill it with saline, which is basically water with salt and chloride. So if you've ever seen an IV bag at the hospital, those are filled with normal saline. So it's basically water with some salt and chloride. So the main difference is that a silicone gel implant will come prefabricated exactly to the filling and the dimensions that we expect. Saline implants also have set dimensions and projections, but they're a little bit variable because if a surgeon adds a little bit more or a little bit less, it can vary. For sure, from the aesthetic point of view, if you're looking at both implants where a patient's just standing and not moving, you won't really be able to tell the difference. But in certain positions you will. For example, when a patient is leaning over on the side, you have more chance of seeing rippling, which is the folds of the shell. And that's more common in thinner patients and more common with saline implants. Of course, it is possible in a very thin patient with silicone gel implants, but less likely. Secondly, if a saline implant ruptures, because it is water, even if there's a small fissure, it will leak and slowly deflate. Or if there's a bigger rupture, you know, patient can wake up with one day with one breast that's completely flat and deflated. It's okay in a health perspective because it's water and so the body could just absorb it, but from an aesthetic point of view, you could imagine waking up one day with a flat on one side is not ideal. Silicone cohesive gel implants, on the other hand, they can rupture, they can fissure as well, but they'll keep their form. So imagine, I always describe it like a piece of jello that's a cube, and if you cut it in half, it'll still stay in the shape of a cube. It's the same principle. So you do have to change them if it ruptures, but at least you won't be in a position where you're in a pickle where one breast is deflated and the other isn't, especially if you have an important event coming up.